This institute has changed over the years to become the East African Virus Research Institute in the 50s, and in the 1970s, the Uganda Virus Research Institute. I think we have done a lot in terms of research, discovery. Many viruses have been discovered here. Examples are West Nile virus, Zika virus. And in the beginning, the Institute was able to understand yellow fever, how yellow fever is transmitted, the vectors that transmit yellow fever. And with time, more viruses were discovered. In the 60s, the Institute started working on immunizable diseases, polio and measles, to understand the immune responses towards polio and measles, but also to understand how we could protect using, of course, the vaccines. In the when HIV came, the Institute was very active, working with different partners to understand HIV, how HIV is transmitted, the risk factors for HIV. We have done a lot of studies on management of HIV and treatment, prevention of HIV. We have done a lot of work to see how HIV, the virus itself, studying the virus, because we have a lot of diversity of virus here, but also studying the immune responses. And then we went into emerging infections. And of course, in the 90s, emerging infections became a major issue. And you saw how COVID came, and the Institute was very active on the management of COVID. So we have done quite a lot. We have many reference labs for the country, for the region. We have been there during outbreaks. We have responded to many outbreaks, Ebola, Marburg, Mpox. Our labs have been very, very active. So we are a public health lab, a research lab that tries to understand the viruses, but also to understand how the virus interacts with the body, looking at immune responses. But we are also very active in responding to outbreaks. The other important thing we do is capacity building, training. We do a lot of training. We have students from universities that come here to do their projects for undergraduates, masters, and PhD. So we are very, very active. We have many partners. Some of them you have heard, the MRC, UVRI, London School, IAVI, NIH, CDC. We have worked a lot, RACAI project. So we have many partners that work. We're a government institution that under the Ministry of Health, but our funding comes from different sources, government, but mostly from international funding through writing research grants. We are very active in embracing new technology. Those who listen to my presentation, you have seen how much of new technology we have introduced. We're also talking about AI that can allow us design antigens that can be used for diagnostics, that can be used for therapy, that can be used for vaccines. So AI will be very important as we move forward. But yes, we have been very active in embracing new technology as we move along. As we celebrate the 90 years, two major activities are also taking place. We are opening tomorrow. Tomorrow is the main celebration. We're going to open a new lab of polio for genomics that is going to be for the region. As we try to end polio, we need to look at what is left. So this lab, funded through Gates and WHO, is going to be open. We're also going to be launched as a center of excellence for East African community. So as we move forward, we're going to continue to be a national, but also a regional lab and international lab. We are going to make sure we strengthen our preparedness to address emerging and re-emerging new infections. We are going to make efforts to look at products like diagnostics, vaccines, and monoclonal antibodies to be important. We are going to look at the connection between infection and non-communicable diseases. So a lot of these are going to be done in the coming years. And we are going to increase our training so that we have many young people trained so that they can bring in money and do good research. So those are some of the areas we're going in. Some of the key challenges, of course, are funding. Funding is limited, especially from government. We have a big area we're on, we have infrastructure. We need to expand. The space is very limited. We need a big building to accommodate all our labs. Our labs are scattered and offices. So train more middle-level scientists so that they can attract funding. And that will be very, very important. And of course, as we move along to make sure that the work we do is relevant for the country.
UVRI started sometime in 1938. And as a ministry, and as a Director General, I want to congratulate this institution, which has grown from initially the work they were doing, which was related to yellow fever, to now more of the work. So we are celebrating this based on discoveries and innovation over those years. This institution is, UVRI actually is a Ministry of Health institution. So there's no question about that. What have you done for and what? So UVRI is a Ministry of Health institutions. He has played a very big role in this and outbreak management. If you all recall that in 2001, samples we had to be sent both South Africa and Atlanta, and that took a lot of time, because now if you look at based on the 7-1 principles that you should be able to take 7 days to make a diagnosis, 1 day to make a notification, and within 7 days respond. If you looked at all studies, you have the senior researcher, but they're also junior, and many people have been able to do their PhDs, masters, and many other research in this area. Uganda Virus Research Institute also has not only, many people know only about viruses, but now it has ventured into many other things which afflict. They are doing a lot of work in non-communicable diseases, but also a lot of work in HIV control and management was done in Uganda Virus Research Institute. So in a nutshell, we think that part of the strengths of Ministry of Health in managing outbreaks, managing pandemics, is embedded into this institution. And as a ministry, we are proud of it and will continue to support its existence. Funding always will not be enough, but I must say that the government, as will continue to provide one, as always continue to provide funding to Uganda Virus Research Institute, but also using other strategies. They have also continued mobilizing money from grants. And now we are also thinking that instead of only looking at all the diagnostics, this institution should be able to partner with institutions like Makerere and actually offer training, so then they can be able to have additional financing streams beyond just what is coming from government.
My name is Dr. Josephine Boji. I head the EPI laboratory. This is the Immunisable Disease Department at Uganda Virus Research Institute. I'm a principal research officer. So this department works on surveillance of vaccine preventable diseases and also on research on vaccine preventable diseases. So our work generally will support the EPI program, both nationally and also at the regional level. So we support them in helping them diagnose mostly polio, measles, and rubella. So as a polio lab, we've been supporting 4 countries in the region. That is Uganda, Tanzania, Southern Sudan, Rwanda, and Burundi. Those are 5 countries. We've been supporting them in finding out where they have polio in their countries. So previously, we had capacity just to test, see yes, there's polio. Would stop at the stage of characterizing and saying yes, this polio could be wild polio virus. But then to really confirm, we used to send samples to South Africa at NICD. And the WHO program was saying that there was a delay in having results out. So last year, they built capacity in some additional 2 labs in the African region. That was the University of Ibadan and the one at Uganda Virus Research Institute. And that is our lab. So we built capacity to be able to sequence and provide results to the WHO program so that they can be able to act fast. Because if you found a polio, you don't want it to spread. You want to take action fast, you immunize fast so that you stop the spread. So that is why we were trained and we got a new facility where we shall be doing this work. So that facility is going to be open tomorrow during this celebration.
and I happen to be the chair of the scientific committee that put together this very interesting and interactive scientific conference. As we celebrate 90 years, it has been a very long journey. As mentioned, the Institute was founded in 1936. It has gone through a lot, eventually becoming the East African Community Virus Research Institute. It was a very prestigious engagement with the Institute, but of course, as you know, in the 70s, when the community broke down, it became the Uganda Virus Research Institute. The Institute is one of the very, very few research institutes that are dedicated to research in virology. I must say, on this day, as we mark the 90 years, tomorrow we shall again be reattaining our status as the ESC, Regional Center of Excellence in Virology. We don't take this lightly, because one of the core mandates that we shall have is to really support the region, especially in capacity building pertaining to response to outbreaks, pandemics, training partners across the different countries. So a lot is really in our docket at the moment. As you are aware, over the years, a lot of capacity has been built beyond the UVRI. Initially, UVRI was almost the only institution that had the capacity to respond to such outbreaks. But over the years, government has been very supportive through its partners to expand our capacity. And we have quite a lot of capacity in the country, including the Central Public Health Labs, which has been very instrumental also in responding to all this. We work very closely with different partners, testing labs at the CPHL, other partners, but very importantly, we do a lot of quality, so the moment they test, we do support them. Quality with the testing, but when also the testing demand is there, we play a critical role of taking on the influx of other samples that come within when we're having these outbreaks. The list is really endless. We have a lot of key achievements. You've listened to the presentations which were done today. The key discoveries of viruses. You've heard of the discovery of West Nile fever virus, discovery of chikungunya, discovery of so many viruses, and even to date, discoveries are being done. When you talk about vaccine production, we are getting into vaccine manufacturing and also production. Most of our researchers are already engaged in this, and we are contributing to development of vaccines. One other key important achievement is capacity building, training of scientists. I'm one of those products. I was trained by this institution. We have had a lot of PhDs, a lot of postdocs. We have had fellows who have moved on to become vice chancellors of universities in this country, who have moved on to move into very important positions in the country and also the region, and we are very proud of that. So when I talk about the discoveries of the viruses, what was presented, for example, they mentioned that to date over 142 new viruses were identified here. And remember, in the ongoing research that we are doing, we have projects which are aligned towards pathogen discovery and surveillance. Discovery means you look out for new viruses, and this is what we are doing. And again, to tell you, there are quite a number of new viruses that have been identified, and the processes of classifying them, giving them names, is currently ongoing, and there are processes which need to be followed. So I need to make this very clear. We don't discover viruses and bring them into the country. We discover the viruses in the country. So these viruses are already there. Now, once a new virus is discovered, one of the things that the Institute does is to do research, to really get to know whether this virus can cause disease, whether this virus is safe. So that is very important. Community perceptions. One of the key things that we do is community engagement. We have a very huge community engagement program. We are dealing with communities. We are disseminating. For example, I'm talking to you and allaying all these fears. So that is really very important.